what an honor to be here with you, Dean Baccarelli, university and school leadership, faculty and staff of the Harvard T.H. Chan School of Public Health, and other distinguished guests. Most of all, it's my honor to be here with you, the incredible class of 2026. I want to take a moment to thank those who supported you and encouraged you to push forward on your academic journey. I have been in your seat, like quite literally, and while today is a celebration of what you have done, persevering, wading through the literature, poring over the data, sweating in the field, and refining your ideas into presentations and theses, I hope you will pause to recognize those who made that perseverance possible. The friends, the mentors, the families whose steady support carried you here. And to those friends and families, we return your graduates to you changed. To you, this auditorium is filled with pride and joy and celebration, but your graduates actually may see the world just a little bit differently now. Where you might see a crowd, they see a cohort. Where you might trust the average, they have learned to question it. Because, after all, the average person has one breast, one testicle, and half a prostate. And where compromise might seem to make common sense, they have learned it doesn't always lead to the best outcome. Because if one person prefers the black pair of shoes and the other prefers the brown, the compromise is actually one of each, the worst of both. This is what public health training does. It sharpens how you see the world. It makes you more curious, more skeptical, more determined to look beneath the surface. And that is exactly what the world needs from you now. We have before us a truly amazing graduating class with so many individuals pursuing work of the highest quality and impact. You have just heard the inspiring story of one of our students, Rajeshwari Subramanian, and her work in co-founding Science to People. Another student, Hee-Soo Shin, is a former South Korean Air Force nursing officer and pediatric ICU nurse who was providing training to help hospitals in Ethiopia and Nepal and Uzbekistan strengthen their specialized care, such as pediatric and cardiac surgery, and who hopes to boost health systems' ability to care for children with complex diseases all around the globe. Then there's Mia Sanchez, a first-generation student who wants to create sustainable solutions for climate change and inspire new generations of scientists. And while she was finishing up her Master's of Science in Environmental Health, she found time to run the Boston Marathon with her 67-year-old grandfather, Carlos. They are the only granddaughter-grandfather pair of record to have run this race together. And still others of you collaborate within student groups such as the Harvard Chan Student Coalition to End Homelessness, a hub for action focused on connecting students to advocacy, volunteer and human rights approaches to address homelessness. And you also participate in organizations across our university that address public health concerns like climate change, such as the Harvard University Center for the Environment at the Salata Institute for Climate and Sustainability. And so now, having heard some of your truly inspiring stories, I have the humbling task of electrifying you. And I want to start with a true story. In November 1751, the 19-year-old George Washington traveled to the wealthy British colony of Barbados, a trip undertaken so his older brother Lawrence could seek treatment for tuberculosis. While there, young George contracted a relatively mild case of smallpox. See, the sprawling colonial life of Washington's plantation home in Virginia offered him little prior exposure to the disease, and he likely had no immunity. After a month of smallpox illness, Washington recovered with just minor scarring and, as we now know, lifelong immunity. Several decades later, during the American Revolutionary War, soldiers arriving from England and Germany brought smallpox with them, exposing a largely immunologically naive colonial population. George Washington, already familiar with the disease from his own illness, initially tried to control its spread by quarantining suspected cases. But by 1777, smallpox was ravaging the Continental Army, estimated to account for as many as 90% of deaths among soldiers. Recognizing that the disease posed a far greater threat than British forces themselves, Washington warned, and I quote, "We have more to dread from it than from the sword of the enemy." He ordered all troops to be sent to Philadelphia, where he commanded their inoculation. Yes, in 1777, inoculation was available through variolation, a smallpox prevention method that was new, in which material from the sores of someone with mild disease was deliberately introduced, usually through a small cut in the skin, into a healthy person. Variolation caused a controlled, typically milder infection that would, with some small risk, leave the person immune to future smallpox. Yes, George Washington, before his presidency, imposed the first vaccine requirement in this country. A move that likely changed the course of history. He was a bold and brave public health hero without ever even knowing it. Now, fast forward to the late 1940s. A physician and epidemiologist named Alexander Lang Muir had just been passed over for the job of New York City Health Commissioner. Disappointed, he instead accepted an invitation to join a small, relatively unknown federal agency, then called the Communicable Disease Center, or CDC, which at that time had existed for only 6 years and had been created primarily to control malaria in the American South, Atlanta, Georgia. Langmuir quickly became frustrated. Doctors and state health officials were reporting disease data in wildly different ways, making it difficult to see patterns and to detect emerging outbreaks. At the same time, the early years of the Cold War brought a new and unsettling fear that biological weapons, pathogens like anthrax and smallpox and plague, might one day be used against civilian populations. And Langmuir believed that the country needed something new, a core of professionals trained not just in theory, but in action. So we began training physicians and veterinarians and statisticians and other health workers in the practical craft of epidemiology, how to collect data systematically, recognize patterns, and investigate outbreaks where they occurred. From that idea, he created a rapid response unit known as the Epidemic Intelligence Service, or EIS. Its unofficial symbol was a shoe with a hole in its sole, a nod to Langmuir's belief in what he called shoe leather epidemiology. The idea that the most important work in public health often happens not in offices or in laboratories, but out in the field, knocking on doors, tracing contacts, and piecing together clues during an outbreak. The model works so well that it is spread far beyond the United States. In 1980, the CDC launched the Field Epidemiology Training Program, modeled directly on EIS, to train disease detectives all around the world. And today, those programs operate in more than 80 countries. Their graduates are ministers of health and leaders of national surveillance systems and advisors to the WHO. Over the past 80 years, Langmuir's idea has quietly built a global workforce capable of detecting and responding to epidemics wherever they occur. What began as one man's response to frustration and to a world filled with uncertainty became something much, much larger, a global network of people dedicated to finding outbreaks early, understanding them quickly, and protecting the health of millions. Now, fast forward again to the summer of 2015. At a pediatric bedside in Michigan, Dr. Mona Hanna-Attisha was caring for children in the community where she herself had grown up after her parents had fled the regime of Saddam Hussein in search of safety and opportunity. At that time, a colleague's mother mentioned something she had heard from community activists in Flint, Michigan. Concerns that the city's drinking water, recently switched to the Flint River, might be contaminated with lead. Dr. Mona did what public health professionals are trained to do. She doggedly followed the question. She and her team analyzed thousands of blood lead tests from children, comparing levels before and after the water switch. What they saw was alarming. The proportion of children with elevated lead levels had nearly doubled across the city, and in some neighborhoods, it had tripled. In September 2015, Dr. Mona stepped to a microphone and shared the findings publicly. Speaking for children who could not speak for themselves, she plainly indicated, Flint's children are being poisoned. The response from powerful institutions was swift and dismissive. Officials said she was splicing and dicing the data. They described the reaction as causing near hysteria. Her press conference, they said, was alarmist and irresponsible. But within a week, the state's own data confirmed what she had found. The problem was real. And Dr. Mona was, in fact, appointed by the Michigan governor to help address the problem, and the water source was eventually changed. The children of Flint could not hold a press conference. They could not challenge authority, and they could not interpret data. But a pediatrician looked at the evidence, understood what it meant, and chose to bravely use her voice. And then, in November 2020, another physician found herself sitting in her chairman's office at Massachusetts General Hospital, reviewing the COVID response across the infectious disease division she led. When she returned to her desk, there was a message waiting. The number had a 202 area code, Washington, D.C., a political number she recognized. She called her husband and told him about the message. His advice was simple. Whatever the question, don't say no. This physician carried with her the familiar baggage so many of us know so well, imposter syndrome, that quiet voice that asks whether you are truly ready for the moment in front of you. When she returned the call, she was asked to consider becoming the 19th director of the Centers for Disease Control and Prevention, a position she never applied for and never quite dared to imagine, especially in the middle of a global pandemic. Her first thought was simple. How could I possibly do this impossible job? And then she did. Yes, that physician is me. And I place myself alongside these stories not because my actions saved an army or because I created a global epidemic workforce or because I spoke for children who had no voice. I include it for a different reason. Because at some moment in your career, perhaps when you will least expect it, you will be asked to step forward. And given the current state of public health today, we are likely to have many of those moments in the years ahead. And you are likely to be the ones to take those calls. The problem may feel too big, the responsibility may feel overwhelming, and that quiet voice inside you may ask, how could I possibly do this? And when that moment comes, I hope you will remember this. You are being asked to make a difference. And then you will rise to the moment, armed with the stellar education you have received here, bolstered by the data and supported in those darkest times by the vast sea of people sitting behind you here today, your family, your friends, and your mentors. Now, the stories I have conveyed were in times of revolutionary war, in times of biomedical threat, in times of population environmental contamination, and in times of pandemic. Public health has never waited for perfect times, only for imperfect people, as we are, willing to step forward. And now that responsibility, and I believe that great gift, belongs to all of you. Trust that you are more ready than you think, and know that what feels impossible today may become the thing that defines you tomorrow. Congratulations to the incredible graduating class of 2026. You got this.